Welcome to the COVID-19 update for today, June 29, 2022. And as usual, we'll be speaking with the Minister of Health, Dr. Frank Anthony, to have the most recent update on what's happening in the health sector in terms of COVID-19. Let's start today's update with the current hospitalization status for COVID-19 in Ghana.
So we have right now 33 persons in hospital, 19 of them at the Ocean View Hospital, with 2 of those persons at Ocean View in the ICU. We have also had persons being hospitalized in other hospitals, for example, Maruka, Sodi, West Demerara, and New Amsterdam.
Minister, there has been some amount of a public notion or a stigma kind of that has been attached to the infectious diseases hospital. Some people have been saying that once you're admitted there, you somehow never come out alive. Let's first talk about the operations there at the infectious diseases hospital from transition ward to the ICU.
So first of all, I want to debunk that myth that people once admitted don't come out alive. That's not true. The majority of persons who have come to the hospital have been discharged. And so the hospital is functioning like any other hospital. But like any other hospital, there would be very critical patients that would come to us that it's very difficult in some instances to save those patients. The doctors and the medical team will try their best, but unfortunately, because of the complications of these patients, it is very often very difficult. I think the treatment that we offer to our patients are the optimum treatment that we can give at this time.
Minister, in terms of the equipment at the infectious diseases hospital, do we have at this moment adequate ventilators and more so staff to care and treat these patients?
We have a full complement of staff at the hospital. As you would know, we have about 198 beds at the COVID-19 hospital. That's quite a lot. We have never used the full capacity of the hospital. And we have a good complement of staff, both nursing, technicians, and medical doctors. We have a number of specialists that from time to time, when required, would come from the Georgetown Hospital to consult with the patients, because as I said before, many of these patients would have other underlying illnesses. So it takes a whole team of specialists sometimes. To make sure that we had adequate amount of ventilators, we set up an ICU at the Ocean View Hospital with about 52 ventilators. So we have adequate amounts of ventilators right now in the ICU. We don't use all of them right now. As I said, we only have 2 patients in the ICU, but we have a large capacity there.
Additionally, Dr. Anthony, we know that being in a hospital in and of itself can take a toll on the mental capacity of these patients. For those people who may require mental health counseling while at the hospital, is this service being offered?
Yes, we have persons who specialize in offering this type of counseling. And in some instances, I think when people have challenges breathing properly, they would like to hear comforting words and people to talk to them and so forth. And we offer that type of service as well. In the last 24 hours, we would have seen about 117 new cases, and this is from 922 tests that were done. Again, I like to emphasize this probably is not all of the cases that were diagnosed, because a lot of people are using self-testing kits. Yeah. So this might be an underrepresentation of the numbers of cases that currently are circulating in the country. So we have for first dose adults 443,681 doses. As I said, that's 86.5%. In terms of second dose, we have administered 343,458 doses. That's 67% of that age cohort. For 12 to 17, we have administered 35,006 doses. That's 48% of that age cohort. And for second dose, we have administered 25,609 doses. That's 35.1% of that age cohort. We have, as you know, started the 5 to 11, and we have, over the last couple of weeks, been giving out the first dose. So far, we have administered 3,404 doses. That's 3.3% of that age cohort. So we still have a lot of work to do there as well.